Greetings, everyone. Today, my topic is understanding bipolar disorders. So, what is bipolar disorder? A mental health condition characterized by extreme mood swings. Either they will have episodes of mania and depression, or they will have an episode of mania. Mania is when mood is very high, and we are going to discuss the symptoms related to mania. Depression is when mood is very low, people have very less energy to do their daily works. So let's go ahead and continue to the next slide. There are different types of bipolar disorder. Bipolar 1 disorder diagnosis is given when patient has a history or current presence of manic episode. They may also have experienced depressive episodes. Bipolar 2 disorder is considered when client has never experienced any manic episode. They may have a depressive episodes and may have a hypomanic episode. Cyclothymic disorder is a chronic mood disorder with at least 2 years of duration. They have many episodes of elevated mood or depressed mood, but they do not fall into a criteria of mania, hypomania, or depression. Then we have a substance and medication-induced bipolar disorder, which is caused by intoxication or withdrawal from substances or medications. Let's talk about symptoms of mania. These people, when they are in a manic episode, they may have an inflated self-esteem or grandiosity. The grandiosity is an unrealistic sense of superiority or uniqueness. It can be manifested as an exaggerated sense of their one's own importance or knowledge, identity, and power. For example, they may be constantly boasting and talking about themselves. Then they will have a decreased need for sleep. Even though they sleep for 2 or 3 hours, they may feel rested. No more talkative than the usual, and they may also have pressure to keep talking. They will have a flight of ideas, or there might be a subjective experience that the thoughts are racing. Then they get distracted very easily. They may have an increase in goal-directed activities, or they may have a psychomotor agitation. They may have excessive involvement in activities that have a high potential to painful consequences, like doing a foolish business investments. So in this next slide, we will go ahead and talk about the difference between hypomania, acute mania, and delirious mania. The biggest difference between hypomania and acute mania is psychosis. In hypomania, there is no psychosis. In acute mania, there is psychosis. So psychosis means when person is not aware of the reality. They are not aware of the surroundings. So it means in acute mania, they have a hallucination and delusions. But in hypomania, there is no hallucination and delusion. Okay, now we'll go over the differences starting with the mood. In hypomania, the mood is very cheerful, expansive, but just remember they do have irritability. They do have an underlying irritability. In acute mania, their mood is more expansive. They are elated, euphoria. You will see irritability, anger, and sadness. In a delirious mania is like more extreme as compared to acute mania. They have a labile mood. Labile mood is when mood keep changing from one expression to another expressions, like they may be crying one time and then laughing another time. They have a feeling of despair ecstasy, which is an extreme happiness, but again they do have an underlying irritability. Then if we talk about cognition and perception, in a hypomania, they have an exhaled self-perception, rapid flow of ideas. They have a heightened perception, but they get easily distracted. In acute mania, they have a fragmentic and psychotic cognition. Their thoughts keep racing, keep coming. So that's why they have a flight of ideas. Again, like I said, they have a hallucinations and delusion. In a delirious mania, they have a clouding of consciousness. They have a confusion, disoriented. They are in a stupor stage. Stupor stage is like a coma when they are, it's like a psych stage. They are just laying on the bed and not responding, or just like calm. Religiosity is a type of delusion where they have so much, they have a connection with God, and God may be giving them instructions. It can be any type of religiosity, but something related to religious. So we know delusion is a false belief. They may also have a delusion of grandeur and persecution, auditory or visual hallucination, extreme distractibility and incoherence. So when they are not able to speak properly, the words coming like incoherent. Then the third difference is in activity and behavior, and we can see that in a hypo, they have increased activity. They are very extroverted. They will go and talk to anyone, very social, very loud talking. Their libido, increased libido, but they have no time to eat, right? So they may not be eating. So possible they have anorexia. Their behavior may be very inappropriate. Then in acute mania, they have excessive psychomotor activity, which is more than hypomania. They have everything increased than hypomania. So increased sexual interest, poor impulse control, social and sexual uninhibition. It means they can just go uninhibited, just go and do anything. They are not scared of anyone. Go talk to anyone, go do whatever activity they want to in a public. Excessive spending, diminished need for sleep, neglected hygiene, and disorganized dress. They may be wearing a bright colors because they're in a very happy stage, but then they might not be any matching, like the maybe shirt may be red color, trousers may be yellow, may no matching in clothes, very disorganized, may have some smell because they may not be bathing, they may not be taking care of themselves because they are so much involved in motor activity, so much talking, they don't sit down. In a delirious mania, they have a franchised, um, which is a franchised psychomotor activity, which is like very excessive activity, agitated, purposeless movement, risk for exhaustion. They are moving so much, they might be pacing so much, they may get exhausted because they don't sleep. They don't feel a need to sleep. And then if they do not sleep for days, few days, they may exhausted and die. So injury, death, if we do not do any intervention. So necessary to give them sleep medication at this stage. In Then if we talk about the hypomania, it is not severe enough to cause any marked impairment or require any hospitalization. So people can live in society, but when it comes to the acute mania, they may have an impairment in their functioning. They require a hospitalization, and the delirious mania, they have a severe clouding of consciousness. So and then all the symptoms of acute mania get intensified in delirious mania, so they definitely need medication, antipsychotic medication, and hospitalization. Okay, we'll go to the next slide. In this slide, I will talk about the different treatment modalities used for a bipolar patients. The individual psychotherapy along with the medication is very effective rather than using the medications alone. Group therapy can be done when the patient's acute stage has gone, and they are able to sit in the group and discuss their problem with other people. So this is very effective for discussing the issues which are caused by their medical conditions, or some their marriage issues, which is caused by this problem. Family therapy is also important because due to their symptoms, they might have done some kind of a behavior which has led to disloyalty in the marriage and to a financial problem related to the client's excessive spending behavior. So, by telling the family, educating the family regarding the symptoms of the patient may help a lot. It is clear that families need to be involved in treatment whenever possible, whenever they can come. CBT or cognitive behavior therapy, usually because of their overrated self-assurance, their overconfidence, because of those symptoms, these people, they keep getting some automated thoughts, and those thoughts are a part of disease. So for example, overconfident individuals may dismiss constructive criticism or advice from the other. They might engage in a risky activities, believing they are more capable than they actually are. They might be overconfidence, which can result in making decisions without considering the potential consequences. So the one way of doing cognitive behavior therapy is to talk about their automated thoughts. The thoughts is coming in their mind, and then try to change their thinking, help them to change that thinking. So it is effective for these patients. So about ele electroconvulsive therapy, I will discuss in a next slide.